Welcome to another video. In this video, we will continue learning pharmacology starting with antidysrhythmic agents. In this part of the series, we are covering important cardiac medications. Antidysrhythmic agents are complex agents with multiple mechanisms of action. They are classified according to their effects on the electrical conduction system of the heart. Here are the antidysrhythmic medications you should know for exams. Adenosine. This medication slows conduction time through the AV node, interrupts AV node pathways to restore normal sinus rhythm. Amiodarone. This medication prolongs repolarization, relaxes smooth muscles, and decreases vascular resistance. Atropine. This medication increases the heart rate by counteracting the muscarine-like actions of acetylcholine and other choline esters. Now let's talk about the important general precautions and interactions of these medications. Know that toxicity is a major concern due to additive effects. Caution is needed when using with an AV block and anticholinergic medications. Let's now focus on one medication at a time when talking about side effects and nursing actions, starting with adenosine. The side adverse effects of this medication is flushing, nausea, bronchospasm, prolonged asystole. Nursing interventions include pushing flush immediately with normal saline when administering with rapid IV. Amiodarone. The side adverse effect of this medication is bradycardia, cardiogenic shock, and pulmonary disorders. Note that this medication is incompatible with heparin and may be given in PO as a maintenance dose. Nursing action includes monitoring for respiratory complications. Important to note about amiodarone hydrochloride is that it may cause pulmonary fibrosis, photosensitivity, bluish skin discoloration, corneal deposits, peripheral neuropathy, tremor, poor coordination, abnormal gait, and hypothyroidism. The electrocardiogram should be monitored for clients receiving amiodarone because they may prolong the QT interval, potentially leading to torsades de pointes. Atropine. Important to know is that when used for life-threatening emergencies, it has no contraindications. Nursing actions include monitoring for dry mouth, blurred vision, photophobia, urinary retention, and constipation. Overall, the most important general nursing actions for all antidysrhythmics medications are the following. Monitor heart rate, respiratory rate, and BP. Monitor electrocardiogram. Provide continuous cardiac monitoring. Maintain therapeutic serum medication levels. Do not administer antidysrhythmics with food because food may affect absorption. Always administer IV antidysrhythmics via an infusion pump. Monitor for signs of fluid retention such as weight gain, peripheral edema, or shortness of breath. Instruct the client to change positions slowly to minimize orthostatic hypotension. Well, that's it for this video. In the next video, we will continue the lesson by learning about antilipemic medications. Thanks for watching.